I think the issue of GVHD is a very important topic because we know that allogenic stem cell transplantation remains today as the only curative treatment for many blood diseases. But unfortunately, several patients are still struggling with graft-versus-host disease, GVHD, especially acute but also chronic GVHD. And we have some good news because both in acute but also chronic GVHD, we have some new treatments, new drugs being approved. And this is extremely important because we had almost more than 40 years of stagnation where we didn't have any new drug except using high-dose corticosteroids. So I think it is a very exciting era for the field of GVHD, and this will make the transplant procedure much better tolerated for the patient, and this, in my opinion, will allow to cure more patients with good quality of life. The most important intervention in a graft-versus-host disease is about prophylaxis and prevention. And actually, it is much better and more effective to try to prevent graft-versus-host disease rather than trying to treat it. And again, I think we have seen some very important advances in the last 10 years. ATG, anti-thymocyte globulins, is a very major drug for the prevention of graft-versus-host disease. And more recently, we have seen the advent of the use of high-dose post-cyclophosphamide, which is infused after the injection of the stem cell graft. And actually now we have studies showing very convincing positive results combining actually ATG and post-cyclophosphamide. So this new prevention approach is extremely important because, of course, the hope is that we will have less acute and less chronic GVHD. And this is extremely important for the patient. Refractory chronic GVHD is really a very difficult and a terrible condition because it alters the quality of life of the patient. Patients have a high rate of infectious complications, long-term use of high-dose corticosteroids, and they have also many different complications. And this is very challenging because these patients are in theory cured of their blood disease. However, they are really facing on a daily basis the issue of severe chronic GVHD. We are lucky because now we have new drugs coming into this field, recently introduced. Ruxolitinib is extremely effective, very safe, easy to use. We have also belumosudil, which is a ROCK2 inhibitor, another oral, very exciting drug with very effective results. Recently, there was also the publication of new data about a monoclonal antibody, axatilimab. So you can see now with 3 new drugs in the field of chronic GVHD, ruxolitinib, belumosudil, and axatilimab, I think the future looks bright, and I hope we will be able to minimize the incidence and severity of chronic GVHD.